We take a lot of responsibility as providers at Denver Health, whether that be people with or without the means to pay, or whether it be an orangutan at the zoo.
So today we did bring in 2 human surgeons, orthopedists from Denver Health.
Hesty and one of her family members just got into a little scuffle. Injuries were to her hands, her feet, and then she got a larger injury to her left elbow. So we suspected there was nerve damage. Denver Health was one of the few places that has anybody who's a specialist in hand and complicated elbow surgeries. They were just a natural, perfect fit for us.
I was excited for the opportunity. I thought it would be really awesome to operate on an animal at the zoo.
I have not operated on non-human primate before. Way back, before medical training, I was a zoology major, so it really was exciting for me. In full disclosure, I begged my way onto this team.
An orangutan's hands and feet are just like a person's hands.
Her foot really did act more like a hand, which is why we were very comfortable taking care of it.
The night before, we had kind of established a preoperative plan, so we studied orangutan anatomy.
Her biggest injury was a bite wound to her left elbow, and if it didn't heal, she could lose the arm, which would be devastating, obviously, for a primate that relies on that to get around her enclosure.
Dr. Churchill was able to wash out and fix her foot fractures while I was working on elevating the rotational flap to cover the defect in her arm.
And Dr. Martin's actually made a beautiful flap and local tissue rearrangement to cover her injury on her left elbow, and that was strikingly similar to humans, with the difference being her skin is much thicker, so he had his work cut out for him there.
I was able to bring Chris, who's one of our hand surgical tech service leads. He was able to make things really smooth as far as the transition from Denver Health to here. And then having a resident and fellow with me, Dr. Mayers, Dr. Kaczynski, working on her hand fracture, which was on the other side.
If we can have somebody who specializes in surgery on those body parts day in and day out, why not have them come assist us so that we can give her the best possible care that she can get?
The operating room experience was similar yet so different than ours here. She was sedated before she came to us. I'm used to meeting my patients in the pre-op area. You sign the surgical site, you talk to them, you review the procedure. She arrived to us fully intubated, fully asleep. I've never encountered hay in my wounds, so that was an experience. It was a public operating room, which was a different experience for me.
Probably the only time I'll have a gallery watching me while I operate, so it was very neat.
What was the same was, that everything's done sterilely, their attention to detail.
It went seamlessly, it went very smooth, and it's part of their mission to, very much help the community.
Denver Zoo has always been kind of a pillar of the Denver community. We're all thrilled that she's back, doing what she's supposed to do, is swing from trees.
It was very easy working with them, and they did fantastic work.
I really wanted to make sure we were doing the right thing for the animal.
She probably wouldn't be healing this quickly and this well without the work they did.
It was a great experience. Everyone was wonderful there, very welcoming, and Hesty was great. She's a wonderful patient.